Hi there, I'm Cindy. I'm a psychotherapist. Today, I'd like to share with you a popular therapy approach. It's called EMDR. Every now and then, clients come to me saying that they would like to try EMDR because they tried talk therapy for months or years, but the symptoms just won't go away. So they want something stronger. EMDR is a little bit different than traditional talk therapy. In EMDR, you don't need to talk through everything in detail, and yet it can make a huge difference. People like it because it's very gentle and they don't have to go through all the trauma memories again and again. So today I will break down what EMDR is, how it works, and why it can be such a game changer for healing trauma. If you tried talk therapy and it didn't work that well, or if you're someone who needs fast or a quicker approach, maybe EMDR can help. So what is EMDR? EMDR is this approach that helps your brain to process and move on from the stuck memories using eye movements or other bilateral stimulations. Bilateral stimulation is a unique technique that's stimulating both sides of your bodies in a rhythmic pattern. Just like when we are walking or running, where the arms and legs naturally move from side to side. In EMDR, they use eye movement to let the client look left and right, and by doing that, it helps to reduce the emotional charge of the traumatic memories. So why does it work? It's kind of similar to REM sleep. When you're sleeping and you have this rapid eye movement while you're dreaming, and then your brain tries to process what happened during the day, and all the memories goes to where it belongs, and then you feel more fresh in the morning. Well, REM sleep does this automatically. EMDR recreates this process manually. It was discovered by Dr. Francine Shapiro in the 1980s. One day she was walking in a park and thinking about something upsetting. As her eyes moved back and forth, she just noticed the memory began to feel less intense and the emotional weight seems to lift. So she tested with a few friends and colleagues. It worked for them as well. Encouraged by the result, she dived into research, redefined the method, and then eventually developed EMDR into this very structured approach. There was a lot of research studies after that. One of the most well-known studies took place at Kaiser from 1997 to 2001. Over 60 participants with PTSD received EMDR therapy, and the result was quite impressive. 77% of the multiple trauma survivors and 100% of the single trauma survivors no longer met the criteria for PTSD after just 6 sessions. Even more impressive is the results were long-lasting, and most participants maintaining improvement at the 15 months follow-up. So today, EMDR is recognized by the major organizations like WHO or APA, American Psychological Association. You probably heard about it before, like the APA style. So they both recognize EMDR as one of the most effective evidence-based treatment for trauma. But what to expect when you are having an EMDR session? With EMDR approach, you will get through 8 phases of treatment. And when I explain it to my clients, I usually just summarize it into 3 stages because nobody will remember 8. Stage 1, it's all about preparation. The therapist will ask about the client's history, current challenges, what do they want to work on, and together they will create a treatment plan. Then the therapist will teach clients some coping skills such as deep breathing or visualization, safe place. You can think of it as building their emotional toolbox. And stage 2 is the core of EMDR. The therapist guides the clients through bilateral stimulation while focusing on the memory. And let's use the example of my best friend moved away when I was 11 and I felt helpless. Then the therapist will help me to process the memory step by step. As the process unfolds, usually clients' distress level, like how much the trauma is bothering them, will likely decrease, and the new insight may pop up. And after that, it's time to replace the old negative belief with new positive ones. For example, from I feel helpless when my friend moved away to I have choice to make new friends. And this process is what we call installation. And then we move on to stage 3, which is the closing stage, where the therapist check how things are going and whether the memory still feels neutral. If new materials has come up, it will be addressed as well. The reason why those stage works so well is because it's help you to restart your brain's natural processing system. So our brain is designed to process emotional experiences, just like our body can heal a a small physical wound. Most of the time, when something stressful happens, your brain processes it, learns from it, and moves on. Let's say you forgot an assignment last week and you feel panicked at first, but after talking to the professor, your brain processes the experience. You learn to set reminders, manage deadlines better, and then you put the whole thing behind. But when something is too stressful or too overwhelming, our memory can just get stuck. So instead of being stored like a normal memory, it stays raw. If there is an internal or external reminder, it will trigger the negative belief that we have about ourselves, about the world. Let's say if someone was robbed on the street, they may form this belief that I am not safe or I am in danger. And next time when they drove by the same neighborhood, they get triggered. The beliefs, the emotional pains, and the memories, they all came back. And the more they think about it, the more frustrated they get. It's like stuck in this loop. So EMDR helps them to break the loop. It helps the brain to build a connection between the trauma memories and the solutions. After EMDR treatment, some people say that the memory is still there, but it doesn't trigger any thoughts or emotions anymore. So EMDR might be worth a try because it's very gentle. Your brain does most of the heavy lifting. EMDR often works faster, and some people start feeling better after just 3 or 4 sessions, especially if it's a single trauma event. If you are curious about trying EMDR, the first step is to find a trained EMDR therapist. Most therapists list the approaches that they use on their website or Psychology Today profile. Thank you so much for watching, and I'll see you next time.